What's going on, crew? In this video, I want to talk a little bit about breathing. And it's kind of one of those things you hear about every so often. It's kind of one of those trendy things you hear about now, especially with a term like breath work, right? But far often times we just don't really understand the quality of our breath, right? And really, even to a deeper level, like what muscles are truly involved, like the diaphragm, for instance. A lot of people, they hear this term, again, just like the term breath work, but the diaphragm specifically, it's a balloon-like muscle that attaches directly to our rib cage. And when we inhale, the diaphragm expands down into our belly, even down into our pelvic floor. But what we have to understand in order to really take advantage of this is stacking, postural stacking. Because though the diaphragm does have access to the pelvic floor, doesn't necessarily indicate that it happens, especially if we're in a less than ideal position. For instance, if our rib cage is bucked up and our hips are dumped forward, right? This is known as an open scissors posture, right? And you can kind of see, if I gave you a side angle here and I try to do that, it would look most familiar in today's day and age in society where people have this position here. They got a big broad chest, their ribs are bucked up, their hips are dumped forward, and you can kind of see where this scissors converges on. It's going to be on my lumbar. So a lot of people in this instance that are in this open scissors pattern are going to have low back pain or have low back pain or have experienced low back pain because of the excessive compression that is chronically happening on their low back. In addition to this, when I'm in this position, this essentially shortens my low back muscles, right? So this essentially means that low back muscles are in a spastic state where the muscles are turned on essentially the entire time. So this is not a good thing because now our low back is yanked on the entire time. In addition to that, the structures are being compressed. We're having uneven wear of the disc, and our breathing is all dysfunctional where we're not actually accessing abdominal wall, pelvic floor. Our diaphragm is essentially just pushed out towards the front of our belly. We want to understand proper breathing patterns, right? And it all starts with the belly breath. So when you breathe in, whether you're sitting upright, and typically when I'm instructing breathing, I have the person lay down because when you're laying down in a supine position, you have the most surface area contact, and this means that gravity is dispersed all across your body. Versus if I'm verticalized, I have less surface area contact relative to Earth, so now I have the most amount of gravity coming down through my central spine. So for this instance, when we're breathing, I'm gonna do it upright here just for demonstrative purposes. So for here, what I really want you to focus on is breath quality. So when we breathe in, of course, I talk about breathing through the nose. So breathing through the nose, inhaling through the nose as much as you're able to, and then exhaling through the nose as well. From there, what you want to focus on is filling the belly up. So what I like to do is I like to use my hands. I'll go one hand on belly, one hand on the chest, and then all I'm doing here is I'm just feeling where I'm breathing. And when I start this, I'm not even trying to control the breath at all. I want to build awareness to what I'm naturally doing. So if I'm here and I notice that I'm breathing and I'm just very shallow, rapid, chesty, necky. This is what I like to refer to as a secondary or accessory breathing strategy. What we really want to focus on, again, is that quality of breath through the belly. So I'm going to be here and I'm going to focus on maybe I get more upright. Because part of it could be postural. Maybe I'm slouched forward, and now when I'm slouched forward, I'm just over-breathing through my chest and secondary muscles. Even neck and scalene muscles can get turned on, which can lead to things like headaches, excessive neck tension, etc. So sit nice and upright, relax the shoulders, focus on breathing through the nose. And the other component of breathing through the nose, outside of things that I've mentioned, are going to be that you can take a fuller breath through your nose. And you can test this right now. Just take one full breath through your nose, as much as you're able to, as full as you can make it, and then exhale. And then take that same breath through the mouth. You're going to notice you're not able to take as a full of a breath through your mouth versus through your nose. In addition to that, when you breathe through your mouth, you're not able to really fill the lower abdominal wall through the breath. Versus if you breathe through the nose, you can really feel that start to extend down into even pelvic floor. Okay, so rewind it back, taking it back with just basic breathing here. One hand on belly, one hand on chest. Pay attention to your breathing. And then after a few rounds of that, try to become more intentional with pushing the belly hand out. Right? So as I inhale, I feel the belly move. I don't really feel much of the chest moving. Right? So maybe it's belly about 90% of the time. And then that other 10%, maybe you start to get a little chesty. Once you start breathing a little bit more ideal, you're gonna feel that belly start to expand more and more and more and more. And it shouldn't just be a front to back expansion. You should also feel lateral expansion because, again, as I mentioned, diaphragm is attached to the rib cage. So if the diaphragm is extending down, what's happening to the ribs? The ribs are also expanding, so you should get lateral expansion as well. The hardest part here is what's known as posterior lateral expansion, which is kind of like that outer back QL area, right? So if I turn around here, you should also feel expansion through the outer side of the back here. And that's full 360-degree circumferential breathing, right? And that's going to create the most stability. So if you think about it, right? If I'm in an open scissors pattern, now in order for me to breathe through my belly, I have to pull my rib cage down, right? I have to set my pelvis to neutral. And what does that do? That stacks the rib cage directly over the pelvis. So now I have vertical breathing, right? And I'm able to breathe and fill and expand through the belly. What's happening now? The diaphragm's expanding in all 360 degrees. In addition to that, the diaphragm is compressing against the spine. So now I'm getting stabilization. I'm stabilizing my spine through something as simple as breathing. So again, a lot of people who have low back pain, who are demonstrating this sort of open scissors posture, I'll correct them by affixing their rib cage down, making sure that you notice as I did that, my chest comes forward and my chin goes forward. So saying, hey, okay, no, open up the shoulders, fix the shoulders, pull the rib cage down. Think of it like retracting the head here. So I like to say, think of it like giving yourself that beautiful double triple chin. Think of it like you're wearing a crown of missiles and you're shooting the crowns into infinity. So with each inhale, you retract. With each exhale, you elongate without changing this position here, and you continue to breathe. If you do that for like 1 to 3 minutes, you're gonna notice a significant difference in one, how you're feeling, your mind state. Your nervous system's gonna be more down-regulated, and your breathing's gonna be a lot more functional. You're gonna feel low back pain almost abolish, just go entirely. And you're gonna feel like, wow, I feel a lot more better. I feel lighter almost. Because essentially what we're doing is we're creating also lift through the breath. So this is a key thing here. We have to understand that ideal breathing strategies can have a cascade of positive outcomes if we just know how to be aware and know how to integrate these strategies. It doesn't have to be perfect. And more than likely when you start out, it's not gonna be perfect, but that's okay. Again, it's building the awareness to the things that you're doing that are not ideal so that you can start to make those corrections. Awareness is key. Make that small behavioral change. Integrate the breath. Make sure you focus on belly breathing here to help the low back. Create circumferential stability. Practice this integration. But it's all going to start from a foundation of breath. So this is a great introductory, and I'm looking forward to seeing you all in the next video.